family see my first slide?
We can see it, Debbie.
Wonderful. And hopefully my sound is good at this point.
Sound great so far.
Okay. All right. So far, so good. All right. Well, good afternoon, everyone. And thank you so much for inviting me to speak on motivational interviewing. And today's little module is really all about using the ORs and how do we do that and to enhance our conversations with individuals that we're working with to improve their ability to make important behavioral health changes. I do not have any disclosures to make regarding any financial relationships with commercial entities. I also will not be discussing any off-label use or investigational products during the course of this presentation. And my slide set has been peer reviewed to ensure that there are no conflicts of interest. I'm happy to report that I'm able to, through the North Florida AIDS Education and Training Center, we will be able to provide CME for all of our medical providers on the call today. And I have a slide which tells you exactly what to do. You will get a 0.5 credit if you are a medical provider. We will be providing at the end of the presentation in the chat room and on my slides the link where you will go in order to complete the evaluation as well as to put in your information about your professional licensure. For those individuals who are not medical providers, but who are nurses, clinical social workers, marriage family counselors, mental health counselors, pharmacists, psychologists, and dentists, and we offer also continuing education for this program today. However, because University of Florida is not a provider of 0.5 credits, what we have done is I have put together a very short self-paced module. So the link that you will use is the same link that our medical providers will use, but when you indicate your profession, the link will take you to the option of seeing and participating in a self-study module that I created just for you. This will allow you, once completed, to obtain a 1.0 credit. So for everyone other than the medical providers, you have the option of obtaining and getting an awarded for a 1.0 hour credit. Unfortunately, we cannot offer the half credit to anyone other than the medical professionals that are on the call. And I apologize for that, but I hope that the short little module that I created that you can do at your own pace will suffice and actually in the long run give you more credit that I hopefully can be very user-friendly to you. Again, we will be providing a link at the end of this program as well as in the chat room. So you will be able to use that link to go to the next step in obtaining your award for your participation today. The learning objectives for today's session are: 1, to describe communication terms, open-ended questions, affirmations, reflections, and summaries, known as the ORs in motivational interviewing speak. And then finally discuss the approaches to the regular use of ORs. How do we do that, and how does it support patient change, behavior change, as well as provide to the client the knowledge that we believe they are experts in their own care and in themselves, and that empowerment, engagement, and participation, and ultimately self-management that we're looking for. So just to bring us all back to what motivational interviewing is a method of counseling. It is an evidence-based method of counseling, and it's designed to facilitate natural change, the patient's internal motivation to commit and to achieve a specific goal, and explore a person's reasons for changing the status quo, whatever that may be for that individual. And the spirit of motivational interviewing is all about that atmosphere of acceptance and compassion that we show as a fundamental part of motivational interviewing. So the goal of motivational interviewing is to increase the client's internal motivation to change a health behavior. It's not about our motivation to have for a client. It is truly the client's own internal motivation. So as I spoke earlier, motivational interviewing is about attitude or spirit. It's the fundamental piece of motivational interviewing. It's the backbone to MI, as we call it. Motivational interviewing spirit is about presence. It's about us being genuine and present in the moment, non-judgmental and understanding. It's showing our cultural humility, which is more than being aware of culture and the lens that a client may be using to see health and to see themselves and the world around them. But it's that humility, that non-judgment, that acceptance that we show to let the client know that we accept them as they are and as the expert that they are. The motivational interviewing practice is based on the trans-theoretical model of change. This was put together by Prochaska and DiClemente. For those of you who may have not have a background in motivational interviewing, there are 5 stages of change according to the trans-theoretical model, which includes pre-contemplation, contemplation, preparation, action, maintenance, keeping the thing going once you've got the new activity or new behavior going. And what is not a stage in the model is a term we call relapse. It is I call a speed bump. It is a speed bump on the journey to change. Many times we fall back when a change that we're making isn't exercised yet enough. It's like a muscle. And we may find ourselves going back to the more comfortable place of the status quo that we came from. Or maybe we didn't see something coming that was in our goal to improve, and we now have had a setback. A setback is not a negative thing. It's not something we judge. It's a learning opportunity. So these are the fundamental principles behind motivational interviewing that I'm sharing here. And this slide really tells it all. When you have someone in the contemplation mode, meaning they are ambivalent, they can see some important reasons to make a health behavior change, but they can also see reasons for not making that change, maintaining the status quo. Maybe right now the status quo is doing nothing, such as in HIV treatment and care. If I have a prescription to fill my antiretroviral medication, I may choose to do nothing. I may sit with that prescription on a countertop and not follow through because I'm ambivalent about starting medication and what that means to me in my life and how I would go about implementing a change in my behavior, which is basically maybe taking no medication at all to suddenly taking 1 medication a day or maybe more. So we're going to talk about the mighty oars, and I just love this picture. It is work, and we have to use our muscles to use the mighty oars, as I call them. And these, again, represent open-ended questions, affirmations, reflections, and summaries. And for those of you who are familiar with motivational interviewing, you probably are aware that there are a lot of mnemonics in motivational interviewing, and it helps us remind us of different things that we can remind ourselves to do when we're speaking with our clients, such as using our mighty oars. So once again, the mighty oars are here on this slide. And we have to paddle hard in order to do these because it's easier to maintain our status quo if we're not already using these oars. The power of the ORs comes with active listening. And active listening is about really listening, focusing on what the person is saying, how they're saying it, and what the words that they're saying mean to them, the person that is speaking. So it's quite intense and can't be done while we're looking at paperwork. It can't really be done while we're checking our phone. This is a very strategic type of listening because we have to respond. We can't just go, uh-huh. We have to really hear what the person's saying and try to understand what they're saying and what it really means to them. So active listening is a big piece of the ORs. So we'll start with open-ended questions, but to do that, I have to start with closed-ended questions. Closed-ended questions are questions that you can answer with a yes or no, such as, are you feeling okay? Did you get your labs drawn last week? Do you have any questions? Did you take all of your medication? Clearly, we can answer any one of these 6 questions with a yes or a no, which really doesn't tell us a whole lot. It may not even tell us what the client is really doing because they may be wanting to please us. They may want to give us an answer that doesn't disappoint us. There may be many reasons for them to answer yes or no. But what if we asked an open-ended question, such as, how are you feeling today? How can I care for you today? What questions do you have for me? What are some tools you use to remember to take your antiretrovirals? What's the most important issue you want to talk to me about today? And what benefits are you hoping to get from the herbal remedy that you just shared with me that you're taking? These are all open-ended questions. You cannot answer them with a yes or a no. And they give us a wonderful way of finding out more from the client. Let's hear their story. An open-ended question allows us to hear what the client is talking and what they're thinking about. So open-ended questions do 3 things. They emphasize choice and autonomy. So here are more questions we could ask. What would you like to talk about? First, maybe medications, condoms? What are some reasons to become undetectable? It allows us to hear what the client knows and thinks about this topic. How important is it for you to take your antiretroviral medication? Why do you do these things? Why would you want to do these things? Why will you do them when you're ready? The second thing that open-ended questions do is that it elicits change talk or sustained talk. Sustained talk is talk where the person is maintaining their status quo. There are no changes occurring. They don't want to make a change. And that would be someone in a pre-contemplative mode. But when someone is ambivalent, they're going to start to give you some information. And the best way to hear about what change and ambivalence they may have about change, you're going to elicit it best by using open-ended questions. So we could do that by, I know it's hard to get to this point, but what are some benefits of continuing this journey in our program? What do you think contributes to a high viral load? How do you feel about these medications and how they might help you? How important is it for you right now to start taking your HIV medications and why? The third thing that the open-ended questions do is it allows us to elicit commitment language, meaning that when someone is past ambivalence and is starting to look at a possible change in a health behavior or adding a new health behavior on board to something that they've never done before, we want to hear commitment, not our commitment, like, okay, you're ready, you're going to do this thing, but their commitment. So by asking open-ended questions, we can elicit that commitment language and then reflect back that we heard it. So for example, we might say, what things do you think are most likely to change before your next appointment? What would be a good way to remind yourself of when to take your medication? You could start tomorrow. So what's your next step and what can I do to help you? So that's commitment language. The next mighty aura is affirmations, A for affirmations. And the purpose is to build feelings of self-efficacy and empowerment. Things that we would say, not, oh, you're looking sharp today. This is about the internal pieces of someone, their personality strengths, their resilience, their courage. Things like it takes courage to face such difficult problems. This is hard work you're doing. Your anger is understandable. Letting someone know that they have a right to be angry over a 3-hour wait time, or that something has happened in their life that they've had no control over, and it's very upsetting and frustrating. And then finally, you might say, you've had a rough time, and your ability to be resilient through all of this is remarkable. We're empowering. We're saying, I see you. And that's very important. We don't use these every other sentence. We use them strategically because a lot of time clients are never given an affirmation in their life. We may be one of the first people that they've met with that actually says, I see you, and I see how hard you're working, or I see your courage, or I see your resilience. So in giving affirmations, you want to use affirmative and positive language. You want to emphasize past successes to build on future successes. You want to reframe behaviors or concerns as evidence of strengths. And also, you want to ask questions to prompt the patient to give themselves their own affirmations. And this is one of my favorite ones, where you might say, what have you noticed about yourself since we've been working together? Especially when you've seen a client make great strides. So these are affirmations that are very empowering and impactful when a client feels that you really see them and you appreciate the strength, or you see the hard work that they're doing. So reflections express interest, empathy, and understanding. They express acceptance, our acceptance of the other. They encourage greater exploration of this strength, because this strength that we're seeing or reframing may be a strength that will be utilized in making an important behavior change going forward. Also, reflections create momentum and gently challenge positions. So our reflections are now a part of the mighty oars. It brings us forward past affirmations and past open-ended questions, because now we're having to do some really active listening. This is reflecting that we heard something important that person was trying to say, and we're checking in with them to be sure that we got it right. The power of reflections, the R in the mighty oars, is again based on active listening. You can't really do a powerful reflection if you're not actively listening to what the person is really telling you. So in forming a reflection, we've got a couple of little helpers here. First, you form a hypothesis of what you believe the speaker means, and this can be something simple. You could actually repeat the words that the person actually used themselves. Or you could make a statement. Remember, this is a reflection. A reflection really isn't a question. It's basically saying, this is what I heard. Did I get that right? And then finally, it's about our voice. When we form a reflection, our voice inflection goes down at the end of the statement, not up. So it is not a question. It is a statement. It's a statement that we're hoping the client will consider and think about and let us know whether we did hear them correctly, or perhaps continue their talk about change or sustaining a behavior. This is a way that we have a back and forth, because remembering that communication is about a back and forth. So reflections can be simple and they can be more complex. A patient might say, I don't think I'm depressed. I'm just having a bad week. The healthcare professional might say, you think you're having a bad week. Or they might say, "You're not sure." I didn't ask a question. I stated back what I thought I heard them say, because now I'm interested in learning more. What more could they tell me about this? And if I got it wrong, and they said, "No, I didn't say that. I'm not depressed, and I don't know what you're talking about," then I would say, "I'm so sorry, I got that wrong. Tell me again so I can better understand." Complex reflections are a little higher level because they may not be exactly what the client says. So here's an example. I'm not sure coming to the clinic is worth my time. The healthcare professional may say as a reflection, "You're not seeing any value in coming to clinic." Now, this reflection goes way past what the client said. It actually went beyond what they said. In my mind, I'm making the statement because I believe they're going to come back and say to me, "Well, no, I don't mean any value. I just mean on this one particular issue." So I'm checking in with them. If I got it wrong, again, I can always stop and say, "I'm sorry, I got that wrong. Tell me again what you meant so I can better understand." So your reflection can go beyond what the client says. It can also go a little minimize what the client said, especially if the client said something that was very forceful. You can minimize it, or you can come in right where the client did by repeating mostly the words that they actually said. So here are some stems, reflection stems for statements that would help you in forming, constructing a reflection. People will often say, "It sounds like," "You're wondering," "You," "That makes me think," or "If I understand you correctly." You can use these, but we don't want to overuse, or you can just simply say a statement. You don't have to have one of these stems to introduce your reflection, but it is an option and it breaks up things a little bit in the conversation. So here's another reflection example. The client says, "I'm nervous that my CD4 count has gone down, even though I've been taking my HIV medicine. Maybe it's not worth staying on medicine. Maybe it doesn't seem to be helping, since it's not helping." The simple reflection would be, you aren't sure if the medicine is helping you. An effective or more emotional sort of keying in on how the person is feeling when they said this might be, you're really worried about what's happening to your body and what a lower CD4 really means for your health. And then finally, a more complex reflection might be, you care so much about controlling your HIV illness and you want to figure out the changes in your blood work and whether the medication is working. You're also wondering what you could do to get better control of the HIV. So that's quite more complex, but it does reflect back what the client may be feeling and saying at the same time. So you can use reflections of this nature to delve into some, issues that have a complexity to them, such as what this client is talking about. They're obviously, this client is feeling a little down on. They've been working hard to take their medication, and now something in their mind isn't going right, and now they're feeling frustrated. So we want to key in on perhaps that feeling that they're having. And if I didn't get it right, if I said, "You seem worried," and they said, "Well, I'm not worried," then I might say, "What might be a better word?" and see if they come up with the word to help me better understand how they truly are feeling. There are also double-sided reflections that highlight ambivalence, which are very helpful when someone is really looking at the pros and cons of starting, let's say, a new behavior or stopping a harmful behavior. The patient in this scenario says, I know I should take my medication all the time to keep me balanced, but I have more energy when I don't take it. Here, the provider might say, on the one hand, you feel that taking your medication is really hard to do. And on the other, you see the value in using it. I want to point out that in this reflection, I chose to use the value in using it, the more positive, reflecting change and the positivity of change. I use that at the end of the statement because people tend to listen to the thing they heard last. So if I say that last, I'm hoping the client will pick up on the value and talk more about the value of making a change in their ambivalence right now. So why do we emphasize reflections? Well, people don't really feel listened to when we ask a ton of questions. Open-ended questions are fantastic, but we also have to let the client know that we're not just all about asking a lot of questions. We're also wanting to understand what they think and what their critical thinking is about these different issues that they know about or are learning about. People feel also understood and cared about when we emphasize that we're listening, and that's what reflections do. Finally, that third point, whose agenda is it? We want the client to know that this is about their agenda. Yes, we do have a role in the expert we are as HIV providers and staff and professionals, but we also want to reflect that they have an agenda as well as we partner together. It also, reflections provide focus. What is on the client's mind? That doesn't happen a lot with questions. Learning about what's on their mind helps us know how to help them move forward. And also, finally, reflections encourage the client to share their thoughts without fear or judgment. It's consistent. They know we're consistently going to come back with these different types of communication skills that give them a sense of safety. Finally, the last mighty MI-OR is summarizing. And I can't emphasize enough how important summarizing is. And it's something we can forget to do. Summarizing is about collecting the information in our 5-minute interaction, in our 15-minute interaction. And if we have the luxury of having a longer interaction, such as a 30-minute or an hour interaction, it allows us to summarize a lot. Also, summaries help us reinforce what has been said. And I tend to choose what I put in a summary. If I'm the one summarizing, then I try to choose on those really important points of change, the things that seem to be very motivating, pulling out that client's motivation as we talked about a certain topic. Also, summaries help us link. It helps us link material and information together that we were discussed during the conversation. It allows us to strategize, as I mentioned this before, to selectively choose the things that are more about change than about the status quo or the sustainable talk that is happening. Finally, it allows us to organize and enhance the patient's understanding of their experience and the visit and get a sense of this important conversation that we had. And remember, the summary is what a client is going to walk away with. It's what's going to be on their mind as they open the door and walk out of our clinic. So it's very powerful. If we don't summarize, there's a tendency not to be able to organize what just happened and not be able to focus on, hopefully, some of that ambivalence that is a motivation to move towards change. Oh, there goes my little oars again. So collecting, just to remind you, I'm a visual learner. So we're collecting information that occurred during the conversation and we're putting it in a basket and almost putting it out there to look at with our client. It's like a checkout process, thinking it as a checkout of at the grocery store. We're also reinforcing. This is what I heard. This is what we talked about that it meant to you. And this is your plan. building a foundation for successful change today and in the future. Linking, bringing together information that was discussed, very important, and we use our oars to do this. Let me also mention here that I have also used the technique of letting the client summarize. And especially a client that I've known for a while, I'll say, hey, do you want to take the summary? We always summarize what we've talked about. You want to try it? Because that allows me to hear what was most important to them. What stood out? What did they link together? What did they put in the basket? But when I do the summary, here's an example. I might say, let me stop and summarize what we've talked about. You're not sure that you want to be here, and you really only came because your partner insisted on it. At the same time, you've had some nagging thoughts of your own about what's been happening, including how tired you've been feeling and how you haven't been interested in your usual activities. Did I miss anything? I'm wondering what you make of all these things. So I would make a big pause at did I miss anything? And if you haven't used this summary technique before, you may find that the client will come and remember something that you didn't, or come up with something that was important to them that you didn't bring up. And that is amazing, because what happens with that is that it lets you can say, wow, yes, you're right. I didn't remember, or I didn't bring that up. And that obviously was very important to you and to this conversation. If the client doesn't say anything and just goes, shakes their head no, as if, no, didn't miss anything, because remember, did I miss anything is really a closed-ended question, but it could be answered with a head nod back and forth. I might follow up with, I'm wondering, what do you make of all these things? Because I would like to give the client the last word, and I would like to hear what they do make of all of this. Because again, that might be the change talk that they're going to remember walking out of our office. So there are 12 strategies of motivational interviewing: asking, listening, and informing. And all of the oars fall into these 12 strategies. And it's out of our purview today to go over all this, but you all will be getting a copy of all these slides with all of the references, and you will also be receiving and being able to obtain the recording of this session that we're having together. I want to share with you a video, and if I can connect it.
It is estimated that 1 in 5 people in the United States are affected by mental health disorders each year, and that over half of individuals living with HIV and AIDS are affected by mental health and/or substance abuse. Mental health and substance use disorders among HIV-positive individuals can affect quality of life, decrease medical adherence, and lead to negative health outcomes.
So I'm setting the scene for someone who is obviously depressed. It's daytime, they're sleeping, they're restless. Now, again, this could be someone that works night shift, but I'll just give you the background that this individual does not work night shift. They are sleeping a lot. Their partner is now bringing to their attention that they're noticing something isn't right. And now we're going to have a follow-up. This is this gentleman's regular follow-up with his provider. So they're going to talk about labs. Let's see where the provider can use her oars, her mighty oars, in discussing the topic of depression and mental health and behavioral health.
Good morning. Really glad you made it in today. How you feeling?
Overall, I'm okay. I really haven't been sleeping like I normally do, but I'm okay.
Well, that's really important. So that certainly can make you not feel well. Have you been worried about coming to this appointment or something?
No, not really.
Well, that's good because I wanted to tell you before I came in, I took a look at your labs and you're actually doing really well. Your viral load has gone way down, and that tells us that you're taking your meds and things are looking good. It's really a big improvement from last time.
Okay, well that's definitely some good news in my life.
That's
So yeah.
really good news. How would you say your mood has been lately?
Well, first of all, when it comes to mood, I really, first of all, I sit up at night and I think about the same thing over and over, which causes me to worry. And then like I've been like really snapping at people, and Doc, you know me, I'm always goofy, silly,
You're
but
fun.
but lately I've been snapping at people and really saying to myself, and which that causes me, especially when I'm by myself, I'm more sad than I would be. I'm sad and kind of don't know where that sadness is coming from. I really haven't had an appetite, and we always talk about eating and how I love to eat. So
Yes, I
I
should
don't
check
know.
that.
So I just haven't had an appetite for some reason.
Yeah, on here I'm noticing that you've actually lost about 5 pounds since your last
What?
visit.
5 pounds?
Well, wait a minute though. Let me ask. Were you trying to lose weight?
No, that's the
That's the
problem. I
thing.
haven't really
Okay.
been eating.
Okay. Well, there's lots of things that could cause the symptoms that you're talking
Mhm.
about right now. But I feel fairly confident that it's not your HIV. We've just gone over all of your lab results. Everything looks
Okay.
really good. I'm wondering if there's something else going on with you. Would it be okay to ask you a few more questions? Yeah, so in reviewing what you've said today, I mean, it sounds like you're having trouble sleeping, you're not quite feeling like yourself, okay, so kind of sad and irritable.
Yeah.
How about your energy level, your motivation? Are you still doing stuff that's important to you?
Well, I did play soccer 3 days a week, but I don't know. I just feel like no energy, and I thought it was because I wasn't getting any sleep. Earlier I told you I wasn't sleeping, so I figured like, maybe that's why I'm not really doing any energy or
Right,
activity.
right. Well, I mean, that could be. Certainly, if you're not
Yeah.
getting sleep, that can make it hard to do other things. But
Yeah.
I'm a little worried that maybe something else is going on. From everything you're telling me, it really sounds like you might be dealing with some depression. I really think it's important that we get an assessment done. Would you be willing to meet with somebody?
Doc, depression really? No. You try to like I'm crazy or something. I'm not crazy.
You know, it's not about being crazy. That's not what this is about. This is making sure that we're addressing everything that could possibly be going on with you. We've done a full physical assessment. I mean, I've looked over all your lab results. Everything looks really good, so I don't think that's what it is. If we don't assess all of it, you may go on feeling like this or even worse. And that could even affect your physical health. People stop taking their medicine, they stop coming to appointments. You've already stopped doing some of the things that are really important to you. What do you suppose will happen if you go on feeling like this? It's just as important to take a look at your mental health as well. And that can be assessed just you meeting with someone and talking to them about what's going on. Would you be willing to do that with you? Can I get you set up for an appointment with somebody? We have somebody here you can talk with.
I stopped it here because in the end, she was very successful at this individual did see value in talking to someone else. There's some really nice things that this provider has done from a motivational interviewing standpoint, and I wish we were in person and we would do some start and stops. But I want to say that she did use a lot of closed-ended questions, but some of her best ones for open-ended were, how would you say your mood has been lately? That was a great open-ended question. She said, it sounds like you're not sleeping. So she used a reflection there. Were you trying to lose weight? I like that. It's a yes or no question because right now you want to ask that question. That's a strategic question you need to know. You don't need more information right now. This is important. It's yes or no. She asked permission to ask more questions, which is very respectful of the client, I think, indeed. She asks, how is your energy level, which is a wonderful way of talking about behavioral health concerns, as opposed to using terminology that might cause a client to withhold or to feel shame. And we could tell by a picture there that feeling crazy. The word she used was depressed. He went right to the word crazy and what that meant for him. So we immediately know that he has his lens of seeing the world is that there is something wrong if you are crazy. And if you have an emotional concern, that might mean that he's crazy. So he is checking in, and I thought she did a beautiful job of saying what it is about, that it's not about crazy. It is about holistic health. And I love the way she put in, you're not doing the things that you normally do, that give you a lot of pleasure in your life, as opposed to focusing on more clinical things, focusing on what he's saying, I'm not sleeping. These are his biggest concerns. And he's not as engaged in his life as he normally is. She also used, and it was hard to hear probably, she used an affirmation. He said, you know me, doc, I'm sort of silly. And she said, you're fun. So again, she used an affirmation. She said, I'm going to reframe that. You're fun. And he said, yeah. So he heard her say, you're fun. So that again, that brought them closer together. The last thing I want to bring to your attention, because I know we're bringing short on time, I could dissect this forever with you. One of the most important things I want to bring to your attention is when he said he wasn't eating much, she looked into the chart and she looked up his weight that day. That was a partnership. She didn't come in with that in her mind that she was going to look at the 5 pounds weight. She responded to him saying, I'm not eating as much as I usually do. And then she looked at the intake weight that day, and they continued their conversation. They worked together, and she brought him along with her, which is very empowering. And notice that he's higher on his clinic chair than she is. She's lower. So the power that a provider plays when we're taller than the client also it affects the way a client responds to us. So she partnered well with this client. I wish she had done a little bit more reflecting. At the very end, she asked 2 closed-ended questions. She's trying to get commitment from him to make an appointment to see a counselor. And she says, can I set you up with an appointment? We have someone here. Would you be willing? So she's asking and rapid firing, I'm calling it, a lot of yes, no questions. It would have been better here to ask an open-ended question, and once he had a pause, then letting them know that there is someone right there in their office that could see them. She doesn't talk about a time at when. Is this going to be a separate appointment, or could this person maybe chat with them today? But again, making sure that you're using your open-ended questions and your summaries to your advantage in partnering with your client. No, we're not going to do that. So normally I would have a big discussion session and we would enjoy talking together about this, but I know that we're crunched on time. I want to summarize and put everything in a basket for you. And that is that the Mighty Oars help us communicate with patients in a way that honors their autonomy and their self-direction. Using the Mighty Oars, we are able to explore patient capacity and ambivalence. Remember, we're looking and focusing on their capacity, not their incapacity, their strengths, and the process of sustainable health behavior change. And we show patients when we use our Mighty Oars our genuine interest, our empathy for them by listening actively to better understand their lived experience that puts them in the expert position of knowing themselves better than anyone else would ever know them. And with that perspective, an individual will feel validated, important, worthwhile, and want to spend time with us and can continue that relationship because they see value in how they feel when they walk out of our office. So I want to thank you in every language I know for joining me today. Thank you. We so appreciate everything that you do in your work, in meeting the challenges and the many needs of our clients and partnering with them in their journey in working with their life as they live with HIV and they learn to self-manage that at the highest possible level. This is the link. The link for you, we'll put it in the chat as well. This link will allow you to go to the University of Florida section where you will be able to request your CE or CME awards for this participation. These slides will also be coming to you. Here's my speaker contact information. For many of you, I see you somewhat on a regular basis, but in case you want to reach out to me, I'd love to hear from you. And if you have questions, please feel free. I know that Jessica and Marcus will send me any questions that you might have put in the chat that I just was unable to attend to in a timely fashion today. Marcus, Jessica, is there anything that we need to do to wrap this up?
Oh, Debbie, that is it. Thank you for your presentation.
Thank you.